Now that we've had some time to reflect on our International Digestive Disease Conference from May of 2019, it's important to highlight some abstracts that weren't highlighted previously. And one of those came from Dr. Sahil Khanna, Dr. Daryl Pardee, and Dr. Saha from the Mayo Clinic in Rochester, Minnesota. What they looked at was the safety of fecal microbiota transplant in patients who are being treated with multiply recurrent C. difficile. This is certainly a topic that has been looked at before, but not with the size and numbers that this current abstract included. Previously, Dr. Colleen Kelly and Dr. Lawrence Brandt looked at smaller cohorts and showed that fecal microbiota transplant seems to be safe when it's applied to patients with multiply recurrent C. difficile. Within this study, what they did was they looked at consecutive patients, 300 total, between September 2012 and April 2016 who received a fecal microbiota transplant. They asked these patients to complete questionnaires 1 week, 1 month, 6 months, and 1 year after the fecal microbiota transplant. And the questionnaires asked about adverse events as well as serious adverse events. Overall, fecal microbiota transplants seemed to be very safe. The median age of individuals who responded was 56, and 25.7% of the individuals had inflammatory bowel disease in addition to multiply recurrent C. difficile infection. When they looked at adverse events, which are relatively minor side effects, the 4 most commonly identified adverse events included diarrhea, constipation, urgency, and abdominal cramps, with diarrhea being the most common. In fact, 44.8% of individuals 12 months after the fecal microbiota transplant still had some loose stools that they classified as diarrhea. In terms of other new symptoms that the individuals got after the fecal transplant, about 10% of people identified de novo or new symptoms. And those included, from a GI standpoint, bloating and gas, which was the most common, as well as urgency, changes in bowel habits, and blood in the stool. The only other area that seemed to have an interesting finding was in the neurologic region, where 11 individuals had identified blurred vision, and we have no clear explanation for why 11 individuals identified that as a potential side effect. However, overall, looking at 300 individuals, fecal microbiota transplant seems to be very safe. That goes along with its incredible efficacy. So as a practitioner, we should feel comfortable administering a fecal microbiota transplant to patients that have multiply recurrent C. difficile because it seems very clear that the benefits of this treatment far outweigh the risks and the safety profile is very, very good.